Hi, everybody. This is just my actual example of the knee injury for you guys to watch and kind of base your ankle injury off of. So basically, it's the knee injury with audio. So here we go. So the athlete, football athlete, injured during a game. He walks up to me on the sideline, complaining that his knee is hurt. He is able to walk without a ton of limping. Um, when I asked him what he did, he says that he had his foot planted and another athlete was blocked into him or falling on the side of his leg. When I asked him to describe what it felt like, he says it felt like his knee gave away and that his knee actually bent to the side. When asked where it hurts, he pointed to the area of the pain as being in the medial side of his knee. He has no history of knee problems. As he walked over the treatment table, he is able to walk, maybe just a slight limp, little ginger walking, but he's able to move without a ton of pain. When he gets up on the table and he pulls up his pant leg, his football pants, you can see that it is swollen. It's considerably bigger than the other side, so his right knee is much bigger. No deformity, nothing sticking out where it shouldn't be, no bruising, no discoloration. Palpation elicits pain over the medial collateral ligament. So when I put my hand on his MCL, it actually causes pain. There is some pain on the joint line in general. So besides the ligament, anywhere along the joint line, it does cause some pain. White test, which is a test for internal swelling of the knee, is positive. So they have a joint effusion. And again, you guys don't know this because it's knee injury, but joint effusions are related to having swelling inside the knee, inside the joint capsule itself. And the knee's joint capsule is pretty big. So it's almost like a big water balloon, but it's internal instead of external like a bursa. No other structures cause pain. So muscles, no pain, patella, no pain, tibia, no pain, fibula, no pain, femur, no pain. Functional testing, active is normal. Athlete complains of a feeling of tightness at the end of flexion. So when an athlete has a knee effusion, they usually complain of tightness when they go into full flexion. It just stretches that swelling inside. They complain of the same thing with passive. So again, a feeling of tightness at the end of flexion as well with passive range of motion. And then there's just a slight decrease in strength, but nothing crazy when compared to the other side as far as resistive. Ligament tests. So the four main ligament tests of the knee are the valgus test, which tests for the MCL, varus test for the LCL, anterior drawer ACL, and posterior drawer is PCL. The only one that is positive is the valgus test, and there's pain and a little bit of laxity. Neurologic is all normal, no sensory motor reflex issues at all. Special tests, checking for fractures with a compression bump test, both are negative. There's a couple special tests that test for meniscus injuries. They do cause a little bit pain, but no classic catching and clicking signs, which would indicate a possible meniscus tear. So in the end, based on my evaluation, my diagnosis is a second-degree MCL sprain. The main reasons why I have come to that is the description of the mechanism. So when an athlete is ran into or has a mechanism, it really would be like a shear force across the joint, which would then cause a tensile force on the medial side, so stretching of that MCL. So you injure your MCL by getting hit on the lateral side of the knee, basically. Location of the pain. Pain is he points right to the medial side of his knee. Palpation elicits pain when you push on the MCL. The MCL ligament test is positive, and there's no other test that would counter my thought process. So I was able to run through that in just under 4 minutes. So in theory, if you know what you're doing and you write it up, you should be able to get these videos done around a 4-minute time frame. So again, this is just my example of it to give you a little bit of an idea as to what yours should look like. I use Screencast-O-Matic so you can see my video, I believe, in the corner as well. You do not have to do that, but if you want to do that, you can. So